Welcome back to another episode of The Heart of Local, where we highlight awesome local providers doing great things in their community. Today I have with me Daisy Barrios-Hani from WFMC Health. Welcome to the show, Daisy.
Thank you.
So let's dive in. I'd love to know a little bit more about your role there at WFMC Health and maybe just a little bit about what you love about working there at WFMC.
So, my role here at WFMC is a behavioral health program coordinator and then also a behavioral health clinician. Some of the things that I really like about the job here is that I get to wear multiple hats. My job consists of being able to see people individually and provide therapy, to working with the doctors here, also working with community and community liaisons, and then also dab into a little bit of looking at policy and then working with state policies.
Interesting. So, what led you into behavioral health in the first place?
When it comes to behavioral health, I feel like a lot of clinicians have either a deep connection because they've experienced some mental health hardships, or maybe have a loved one that has experienced some mental health hardships. So I'm no different. I went into this field not really knowing that I wanted to go into the field. I went ahead and gravitated towards a lot of classes in my academic journey that had to do with mental health, with social justice, and a lot of other things. And it led me into social work and working with individuals in therapy.
Tell me a little bit more about your team there at WFMC Health. Yeah, just what makes you unique and what more do you love about the team itself?
So we are a small team, small but mighty is what I call it. We are five clinicians. We have a social work intern, and we also have a community health worker. Some of the things that I really do think make us unique is the way that our clinic operates. WFMC Health is a nonprofit and allows us to really work with individuals in a medical setting and spend time to really just kind of help them in their healing journey. Sometimes that looks like a 30-minute visit, sometimes it looks like a 90-minute visit. It really just depends. But we're able to go ahead and work with individuals at different levels. We have a clinic that really supports us. They really put at the forefront providing individuals with quality services. I've never really worked in an agency that really puts a lot into their staff and providing quality care for patients. So I would say those kind of things really make us unique.
That's awesome. So it sounds like you're really supported from the overall organization as a team there in behavioral health. That's great.
Yes, yes. And then we have a team that is bilingual. Everybody except for our intern is bilingual, so we are able to provide the services in English and Spanish. So a lot of our patients who are monolingual Spanish speakers are able to go ahead and get really good quality therapy and interventions because of it in their own language.
Yeah, I know that's really important there at WFMC Health. Um, Tell me what that's meant for, like, expand on that, what that's meant for the community, the Spanish speaking community, for you to be able to be inclusive in that area, in language, and in all the services you provide.
I think it's really well received in the community. Some of the things that I hear about patients is that they're opening up for the first time. You know, a lot of the times we have a lot of first timers. There's also a lot of like mental health stigma out there in the communities and just in general, especially with the Latinx population. So it's something that they feel comfortable coming to a medical setting and maybe looking at it because it's symptoms that have to do with that they feel in their body and they're wanting answers for, but they're not really considering maybe the mental health aspect of it. So we often get to a lot of people with anxiety symptoms. They have either panic attacks or experiencing things in their body that they don't know what's going on. And they're looking for answers, and oftentimes they feel really hopeless about it. So being able to be integrated and have that ability to be a first contact for individuals, I think it's been really huge and very welcoming in the community.
Nice. I know WFMC Health talks a lot about integrated care. For those listening, tell us a little bit more about that, what that means, and then specifically, like for your portion of the team.
Integrated care really has to do with the body and mind connection. We are oftentimes really teaching that to our patients. So it has to do with the medical side and the mental side, really kind of a marriage, a more holistic approach and taking a look at it.
And that's also part of the unique aspects of what you provide there, is it not?
It is.
Yeah, that's great. So since it's integrated, and somebody may be coming in for a medical appointment, and then there's a handoff, right? I mean, so talk about that handoff to your team. What does that look like?
So the way that it looks like is if a patient comes into the clinic and checks in, we have a process where we provide screenings for individuals. We're oftentimes looking for any type of symptoms that have to do with somebody's mental health state. If there's anything in the screenings or in that interaction with patients that lets any of the staff members know, be it an RN, be it a medical assistant, be it one of the doctors, they're able to go ahead and get access to behavioral health within minutes. So we are available. We have a schedule that really allows for us to be able to spend time with patients and determine maybe what's going on and go from there and provide a treatment plan that is more integrated to the whole person rather than just a piece of it.
Yeah, I imagine there's during that warm handoff or just in general meeting with your team for the first time, there may be some anxiety. I think you alluded to that earlier, but how does your team kind of handle that anxiety? How do you make them feel welcome, and build that trust with your patient?
I think you said it a lot. We get a lot of different mixed emotions from people. Some people are anxious. They don't really know what to expect. Sometimes they're even confused as to why behavioral health is there. And there's sometimes where they're really excited because they've been trying to connect with services and they just haven't been able to connect anywhere in the community. And it's sometimes even months before they can have contact with maybe a counselor or therapist. Really, we try to make it a safe space for individuals, and that definitely has to do with the rapport they've built here at the clinic. They have usually a good rapport with their provider or their doctor. They know that their doctor is not going to recommend anything that they don't feel would be useful for them. So we oftentimes have already gained trust in that way, but we have a team that is very receptive to trauma, very receptive to social justice, very receptive to people's energy. And when it comes to the way that we come in, we're there to really listen, to really see if there's anything that we can help with. So we try our best to make sure that they're comfortable when we're meeting with them. And sometimes that means maybe not meeting in the exam room. Sometimes that means meeting in one of the offices that is a little bit away from some of the busyness of the clinic.
Sure. Uh, Can you expand at all on, like, you mentioned several things there, but like after an appointment, how do you want them to feel?
I hope that when people come in for an appointment and leave, that they felt like they were listened to, they felt that they were respected, that they feel like maybe there's some sort of a plan to what's causing them some distress. And we try our best to be able to do that. Even if we're not able to provide the service here, we definitely make sure that we try to get them to the place that they can get the service that they're needing.
Yeah, that's great. Just curious on the personal side, like what gets you through hard days?
I think what gets me through a really hard day is I have a team in behavioral health and even just here in the clinic, we have really good relationships with each other. Just the other day, we decided to take a little bit of a day trip to the Hot Springs and make it a coworker outing and really just provide a space where we can socialize, we can support each other, we can talk about things and case things whenever any support is needed, because some of the things that we hear in this job are very difficult. And it doesn't just stay there. We take that energy too.
Sure. What are some of the things that you love to do personally?
I really enjoy spending time with my partner, spending time with my animals, doing outings out. And I really, really, really want to do a very extensive type of garden that really includes a lot of sustainability aspects of it. It's still in the works, but I think I get closer to it every year.
That's
Yeah.
great. So just kind of in closing, like if just to think about if someone is still unsure, maybe they're watching this or one of the videos and they're still a little bit unsure about reaching out to your team, what would you say to that person?
I know sometimes it's a big ask to go ahead and start getting connected and start speaking about kind of what's going on. But oftentimes we either have personal experience or it's kind of like what we do here. Hopefully we could at least provide a listening ear, even if somebody doesn't know what they need at the moment. We're here to just help and help with whatever we can. So if it's something that they're thinking about, hopefully they make that step and get connected.
That's great. Anything else you'd like to add about your role, about WFMC Health, or just behavioral health in general?
Yeah. I think the only thing that I would add in addition to some of the things that we talked about is when it comes to my own personal experience, in my teenage years, I struggled a lot with depression and anxiety. And culturally, we didn't have any insurance like growing up. My parents were immigrants, and there just was this lack of safety when it came to getting connected to government resources. So the one thing we did make a priority is when somebody needed any medical care, we would try to go ahead and make sure that that can happen. I think it would have been really great to have some sort of an integrated team where instead of letting certain mental health disorders go for so long, that you can get that service in the clinic. Because I was even showing up with a lot of somatic symptoms, that it would have been really awesome to go ahead and find out that, hey, a lot of what you're dealing with might be showing up physically, and you might be experiencing all these physical symptoms, whether it's the racing heart rate, whether it's the shortness of breath, whether it's a lot of stomach GI issues. And it would have been great to make that connection to get that service. So I really do think there's a lot of headway that we can do by having this kind of team and be able to catch things earlier and maybe not leave people in a state where they're suffering longer than they should be.
Great. Well, Daisy, thank you so much for sharing with us and for the great work you do in our community. But looking forward to sharing this and I appreciate all you do.
Thank you, Tim.